California health officials will order a big batch of hepatitis A vaccine this week, after Governor Jerry Brown declared a state of emergency to combat one of the state's biggest outbreaks of the liver infection in 2 decades. Hepatitis A has been racing through homeless populations in San Diego, Los Angeles and Santa Cruz. As of mid-October, 576 people became ill, 386 went to the hospital, and 18 people died due to the outbreak. Vaccination is the most effective means to prevent additional cases, said Dr. Gil Chavez, state epidemiologist for the Center for Infectious Diseases at California's Public Health Department. The state has received 81,000 doses of the vaccine free of charge from the Centers for Disease Control and Prevention, Chavez said, representing a big chunk of the federal government's total supply for the year. And it's not enough. It's been very clear that our continued requests for additional vaccine is running into the limit of what they can share with California, Chavez said. The governor's emergency proclamation, issued Friday, allows the state to draw money from the general budget to order more vaccines directly from manufacturers. We believe that, if we procure our own vaccine, we will have more control over the vaccine supply and who gets vaccination, he said. We have the capacity to use as much vaccine as we can get our hands on. Hepatitis A is a viral infection that attacks the liver, causing fever, nausea and abdominal discomfort, followed by yellowing of the skin. It is typically spread when an infected person doesn't wash their hands after using the bathroom, then touches food or public surfaces. It has spread quickly among drug users and in crowded homeless communities that lack public restrooms and sinks, growing into the largest person hepatitis A outbreak in the state since a vaccine was developed 22 years ago, according to the governor's emergency proclamation. Several counties, including Sacramento, Orange and San Francisco, have been proactively offering vaccinations at shelters, drop-in centers, food pantries and tent encampments. We do not have an outbreak of hepatitis A in San Francisco and we want to keep it that way, said Dr. Tomas Aragon, the city's health officer. The best way to prevent that is by vaccinating as many people as we can who are at risk. There is no increased risk of infection in the general population, Chavez said. The state usually sees about 150 cases of hepatitis A per year, mainly among people who travel to, or are visiting from, countries where the virus is common. The Hep A vaccine has been routinely recommended for children in California since 1999, meaning most kids and teens are protected against the disease. Otherwise, good sanitation and thorough hand washing is the best protection. Though the Hep A vaccine is normally administered in 2 doses that are 6 months apart, Chavez said even getting only the first dose can prevent infection for up to 20 years. The first dose is one that gives you a very high level of immunity, he said. We believe that, if we are able to get only 1 dose in people, that will be sufficient to contain the outbreak. California declares emergency in fight against hepatitis A outbreak 16 October 2017. April Dembski is the health reporter for the California Report and kqed News. She covers health policy and public health, and has reported extensively on the economics of healthcare, the rollout of the Affordable Care Act in California, mental health and end-of-life issues. Her work is regularly rebroadcast on NPR and has been recognized with awards from the Society for Professional Journalists for Sports Reporting and the Association of Healthcare Journalists for a story about pediatric hospice. Her hour-long radio documentary about home funerals won the Best New Artist Award from the Third Coast International Audio Festival in 2009. April occasionally moonlights on the Arts Beat, covering music and dance. Her story about the First Symphony Orchestra at Burning Man won the award for Best Use of Sound from the Public Radio News Directors Incorporated. Before joining kqed in 2013, April covered technology in Silicon Valley for the Financial Times and freelanced for Marketplace in the New York Times. She is a graduate of the University of California at Berkeley Graduate School of Journalism and Smith College.